What's the one thing everybody wants to do when they have cancer? They want to live. The Ralph Lauren Center serves as the community outreach and engagement arm for the Georgetown Lombardi Comprehensive Cancer Center. We are a part of the fabric of the community. We focus on the impoverished communities, those that have the highest incidence and mortality rates for cancers, and social determinants of health play a major role in those metrics.
Very early on, we realized that access to services was a major hurdle in terms of our work. And for that reason, we chose to go into the communities where we are most needed. And by doing so, we are able to understand what their difficulties and challenges are.
With the most vulnerable patient populations, they're struggling to put food on the table, and so are all their friends and family.
They're underinsured, or they have other social determinants of health that limit them getting care.
They have language barrier. Sometimes they have financial barrier. They don't have a hospital nearby. So we make that connection, that bridge.
That is important in terms of building trust within the communities and for them to see us as partners because we are not a standalone center.
Ralph Lauren Center provides navigation, community health education, nutrition education to the community.
Good morning. We ensure to walk the patient by the hand, and we make the right connection for that patient based on the need.
We navigate patients from beginning to end, the entire continuum. We educate them, they come and get screened, and once they are diagnosed, we get them whatever services are needed for them to go and get cancer treatment.
My name is Tony Montero. I am 60 years old. I was born right here in Washington, D.C., so I am an original Washingtonian.
Tony came to us initially from a referral indicating that she had major medical problems going on. What started as an initial cancer diagnosis impacted her income, her employment, her housing, challenges which occurred at what is probably the most difficult time in her life.
After my husband passed, I was having a hard time getting ends to meet. My Social Security still hadn't come through.
She had been working, but when she got the cancer diagnosis, the bills piled up. Her landlord had filed an eviction case in D.C. Superior Court.
One of my doctor's appointments, I just basically told him, I don't know what I'm going to be able to do. My doctor, she was like, you know what? I think I got some help for you.
So we got to work. We figured out how to advocate at Social Security, which left us with enough financial resources to go to the landlord and negotiate a settlement. With that in hand, we were able to walk down to the court, file the settlement, and get the case dismissed.
You'd be surprised how many people don't know that this kind of help and services are out there. You'd be surprised how many people go without because there's nobody there to tell them somebody has their back.
Someone that they didn't know that we are here, and they can't believe the things that we offer. They're like, how much do I have to pay? I said, no, it's free. We do it because we wanted to eliminate barriers and we wanted to impact the community. Our patients is our top priority.
Our hope is that the patient of the Ralph Lauren Center never feels alone. They feel like they have someone who will go to bat for them, who's going to be their resource.
They were the advocacy that I needed the most.
The work of the Ralph Lauren Center for Cancer Prevention is pivotal. By touching one life, we'll have an impact on many other lives in terms of cancer prevention, in terms of moving research forwards.
If people have their care and everything is taken care of for them, they are willing to participate in clinical trials. We want to facilitate the research so that people will be able to participate in state-of-the-art care. We are inviting people to make certain that we are reducing mortality among our community. We cannot do it alone.